Սիրելի բարեկամներ, այսօր դարձյալ մեր եթերը տրամադրում ենք հայ-ամերիկյան առողջապահական միությանը։ Դոկտոր Քարատոպրակին, որի հյուրն է դոկտոր Միհրան Սաֆարյանը իր օգտակար խորհուրդներով։
Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. This program is sponsored by Holy Name Medical Center. Today we have a very interesting program. We'll be talking about two common contagious diseases. One of them is called Clostridium difficile. In short, it is C. diff. And the other one is methicillin-resistant Staph aureus, which in short called MRSA. Our guest today is Dr. Miran Safarian, who is infectious disease specialist and board certified in infectious disease. Dr. Safarian, welcome.
Thank you for having me.
We have this common two infectious diseases that we encounter all the time in the office, in the hospital. Let's talk about from Clostridium difficile infection first, which is in short called C. difficile infection. C. diff. What is C. diff? It is, and how it's transmitted to person.
C. difficile or C. diff, it's an infection that is acquired by patients who have certain medical problems, who receive basically antibiotics. That puts a pressure on the normal gut flora, and ultimately the C. difficile bacteria takes over and causes inflammation and infection of their colon.
Right. Because the antibiotic kills normal flora,
Yes.
and the C. difficile flourishes there.
That's correct. Abdominal pain, diarrhea, fever, these are all the symptoms of patients who acquired C. difficile infection.
Right. And this can be in the hospital and at office too, because I had patients that I gave antibiotics for sinusitis and they came back with C. difficile infection. So it's very common with the antibiotics.
That is so true. That seems to be the major risk factor is antibiotic administration, and a patient, the older they get other medical problems, which all of that put them at risk for getting C. difficile.
So do we stop the antibiotic at that point, and what do we do if they have the C. difficile infection?
Well, we have to be obviously very careful whenever we administer antibiotic, especially to our older population. Now, if the initial infection that you are treating with the antibiotics is done, then obviously you could stop the antibiotic immediately and start concentrating on the C. difficile issue, which requires a whole different set of antibiotics, as we're going to talk about later.
Right. So we'll be having different antibiotics for C. difficile infection.
Yes.
Is there any place for probiotics or yogurt, eating yogurt that patients usually ask, that should we advise them to have yogurt or probiotics with the antibiotics that we give to them?
Yeah, it seems that probiotics may have a beneficial role in patients who need antibiotics for any kind of infections. It is not a clear-cut benefit, but it seems from reading the infectious disease literature that there is some beneficial role. So if patients are receiving antibiotic, let's say for sinusitis or urinary infection, it may be a good idea to prescribe probiotic concomitantly with the antibiotics.
And this is very contagious, yes?
C. difficile is very contagious.
Right, so this can go from person to person.
It can go from person to person who share the same surfaces that the other patient have used.
If somebody is coming from hospital and they had C. difficile infection in the hospital, we see a lot actually, and we send them home with antibiotic. Do they have to have any concern when they go home? Now they are being treated with antibiotic and coming from hospital to home or from nursing home, which we have some patients in that situation.
Yeah, that's a very important point. Whenever you prescribe antibiotic to patients and they go home from the hospital or from the nursing home, they have to be aware that if they develop new fever or new diarrhea or new abdominal pain, which we talked about, these are the symptoms of C. difficile earlier.
Right.
If they develop that, then they should be aware that maybe what they are experiencing is antibiotic-related C. difficile infection, and they should alert their own physician immediately.
What kind of antibiotics that you said we give to C. difficile infection?
Yeah, the most common antibiotic for C. difficile infection is an antibiotic called Flagyl, and the second one called vancomycin.
Right.
But it is also important for the public to know that because of these problems with receiving antibiotics and the risk for C. difficile, that the public should try to stay away from taking any unnecessary antibiotic, let's say for a cold or the flu, because these antibiotics, when they've been treated put the patients at risk for CDVC.
Right,
So they have to be very
really
careful.
it is important that they discuss with their physician. Now let's go to another contagious infection that we have, which is called MRSA, methicillin-resistant Staph aureus, and it's common in the hospital. Now we see, as in my practice, I see actually more often outpatient with skin infection that patients come into the office. What is MRSA? What is this methicillin-resistant Staph aureus?
MRSA is a type of staph. It's a bacteria again that normally can colonize our skin. It resides on our skin. And it is not different than the regular Staph aureus or the methicillin susceptible Staph aureus, but the MRSA has a different, obviously, treatment protocols and different antibiotics.
Because it's resistant to methicillin,
resistant.
especially the most common antibiotic. Right?
Exactly, it's resistant to the most common antibiotics, but in the same time, it is pretty much like regular Staph aureus, where it resides on the skin and causes skin infections.
It is very contagious. Obviously, in the hospital, we have to gown and put the gloves on. How about this patient that if has a skin infection, has MRSA, and is at home? How other people should protect themselves from this MRSA infection?
Again, the most important part in protection for household member is hand hygiene, is washing their hands with soap and water whenever they come in contact with their family
Patient's skin,
members.
right.
Exactly. Also, another thing is if patient has a MRSA, maybe household member would be advised not to hug or kiss or come very close until the patient is free from their MRSA infection. So these simple techniques and not sharing the same, let's say, clothes or utensils, if you do that, then you are reducing
The
your
towels,
chance.
probably.
The towels,
Especially the
exactly.
towels,
the
right?
towels.
Yes.
Yeah,
Okay.
you are reducing the chance of acquiring MRSA.
Let's say if it's husband and wife, and then one of them has a MRSA infection on the skin, they should be really not sharing the bed even until the skin infection is treated, because it can be contact.
Yes, it's preferable to do that just until the patient is treated.
Right. Is there any other systemic symptoms that MRSA can give to the patients?
Well, sure. MRSA infection can not only cause skin problems, but can cause a whole host of other systemic infections, including the blood and the lungs and many other sites of
It can
infections.
be in the urine.
Of course,
Right.
it can be in the
cultured
urine.
in the urine,
Sure.
colonized in the urine. Right.
Yes.
And the treatment will be different, obviously, for each of them.
Yes.
And it can be very dangerous, and it can be sepsis coming in with that kind of systemic infections.
Yes.
So people should not be taking lightly the MRSA infection if it's on the skin even, because it can cause a systemic infection and end up sending them to the hospital.
That is so true. And if the patient has other predisposing medical conditions that put them at risk for having a systemic infection from MRSA, then they could get into sepsis, condition you just talked about, which requires a whole host of other interventions.
Thank you, Dr. Safarian. We appreciated you coming here and giving us information about these two contagious diseases. Now it's time for this week's article. It is about processed meat consumption and mortality. In Western world, meat consumption has increased. Meat has saturated fat content, which increases the risk of coronary artery disease. Processed meats are even more detrimental to health because they contain nitrates to improve their taste and shelf life. Nitrates can cause the formation of carcinogens and are linked to colorectal and stomach cancer. Recently, international team of researchers examined the association of red meat, processed meat, and poultry consumption with the risk of early death. The end result was high consumption of processed meat intake increased the risk of early mortality due to heart attack and cancer in particular. So stay away from processed meats like bacon, sausages, salamis, hot dogs, and cold cuts, and consume lean red meat and poultry without skin in moderation, and eat some more fish. Good health is precious. Stay informed by visiting AAHPO's website, aahpo.org. This is Dr. Orhan Kratoprak. Until next program, so long.